We discuss the state of COVID in Nevada with healthcare leaders. That's today on Nevada Week.
Support for Nevada Week is provided by Senator William H. Hernstat, Cashman Equipment, and additional supporting sponsors.
On both the local and federal level, plans are being drawn for how to reopen post-COVID. In an address to the state, Governor Sisolak said Nevada will open in phases, with each next step informed by medical, public health, and economic development experts. We are discussing the current state of COVID-19, plus whether we've flattened the curve enough to reopen, with Brian Labus, assistant professor at the UNLV School of Public Health, Dr. Shadaba Assad, medical director of infectious disease at UMC, Dr. Joseph Corcoran, chief medical officer for HCA Healthcare Far West Region, and Dr. Vit Kroshar, medical investigator at the Southern Nevada Health District. Well, thank you so much for joining us. We really appreciate it. And I wanted to take this opportunity also on behalf of all of our Vegas PBS staff, our members, our viewership as well, to thank all of you, not only you, of course, but your teams, your colleagues, for the work that you're doing, the sacrifices that you're making, the risks that you're taking, not only now, but of course over the next, we don't really know how long this is going to be. We really appreciate it. Thank you so much. And with that, related to that, I just want to go into, we're looking at data. We're looking at maybe some encouraging results here. Maybe we're looking beyond the flattening of the curve and we're starting to look at what regular life could be. But I want to bring a little bit more attention back to what we might be overlooking, which is that there is still immediate work happening right now. It is extremely critical to getting us to where we can reopen. Dr. Corcoran, I want to start with you. Managing hospitals on a daily basis without COVID-19 is a complex scenario here. What's day-to-day like, and how maybe has it evolved over the last several weeks to where you are right now?
Yeah, thanks very much, Kip. So as you know, HCA Healthcare has 3 hospitals in the market: Sunrise Medical Center, Mountain View Hospital, and Southern Hills Hospital. And I'll be honest with you, since our first patient came into our first hospital in the Silicon Valley on January 28th, it's been all COVID all the time for the last 10 weeks. So I'm kind of looking forward to getting over that hump that you just referenced so that we can kind of get back to normal operations. I play the Dr. Fauci on my team. I have to be the one who looks out for the clinical considerations. And one of the things I'm always kind of hazarding about is, hey, guys, let's make sure that we're looking at the data and seeing what it's telling us, not Rorschaching it and seeing what we want to see in it. So I agree with you. I think we're getting close to turning the curve. I think we're close to the apex of the disease's prevalence here in Clark County. We've seen a dramatic shift in our own data about like the doubling time that it takes for the number of patients to double from one day to the next. That's climbed from about 8.5 days a week ago to almost 18 days today. So clearly we're seeing some slowing down in that upward trajectory. We're also seeing a very consistent clinical picture that about 45% of the patients end up in the ICU and about half of them end up on ventilators, a little bit less than half of them. So about 23% are ending up on ventilators. So the care has been very consistent. We've had some great stories of great outcomes. We've kind of discovered some very innovative approaches to care that have really benefited a lot of our patients. But as you suggest, we're very anxious to get back to the regular chaos of running hospitals and the complex issues that we face every day.
And Dr. Assad, let's talk a little bit more specifically about patient needs here, where we are now, and maybe how that's also evolved from where we were a couple weeks ago. What are some of the challenges that you are dealing with now? How are those different than the challenges maybe that you dealt with 3 weeks ago?
I think when the whole pandemic started, one of the greatest challenges was adequate availability of testing. not just in our hospitals, but also as an outpatient. As this pandemic has evolved, availability of testing has eased up a little bit, particularly at UMC now. Testing is easily available. We have in-house testing freely available now. We have good turnaround testing time, and that has helped greatly in the way we provide care for our patients. Within hours of a patient presenting to our hospital, we have a result for a COVID test, and that helps us in triaging our patients into dedicated floors, either in the ICU or on the medical floor, where they can then be taken care of by dedicated teams of nurses and physicians. So that's one of the big changes that has happened for us as this pandemic has evolved. The other thing is, as time has gone on and more data is becoming available, we've refined the treatment that we've offered these patients. When we started out, the information that we had only pointed to things like hydroxychloroquine and perhaps some protease inhibitors like Kaletra being available. Since then, more and more data has become available about these drugs. There are studies that are pointing to efficacy or lack thereof, as well as increasing evidence of side effects of these medications. Um, Preliminary data from effects of other medications like remdesivir is becoming available. We're learning about new modalities for treatment such as convalescent plasma, which have a better track record, as well as we have more experience with those modalities of treatment with other infections. They have less side effects. We're learning more about critical care management of these patients, like Dr. Corcoran just mentioned. We're learning about ways of ventilating these patients. We're learning about how to prone these patients. So as time has gone on, we started out with a virus that 4 months ago nobody in the world knew anything about. As time has evolved, we've learned more about the virus in terms of its pathogenicity, the periods of infectivity of this virus, how it spreads, what is the main modes of transmission, which allowed us to refine the way we used our PPE in hospitals. We've learned more about the diagnostics for the virus. We've learned more about treatments for the virus. So for us, those are the things that have changed real time as this pandemic has evolved.
And Brian, let's go to the public side here. I mean, we are talking about an unprecedented public response that we've had. We've raced to educate the public, and the public has then raced to respond. How do you grade us? How well have we done over the last 3 weeks to 4 weeks to where we are now?
It's easy to point out the problems and the things that might happen. We have to think about this being a completely unprecedented situation. We've never asked people to stay home for an extended period of time. We've never done anything like this. So amazing to think what we've accomplished in a very short time. I think the public's starting to get tired of staying at home, which is one of the challenges, because I think a lot of people look at it as we hit the peak, we're done. Well, it's not a finish line. It's like climbing a mountain. You still have to climb back down once you reach that peak. And it's just as dangerous on the climb down as it is on the climb up. So I think getting people to understand that is a bit of a challenge, and making people understand they need to continue to maintain these social distancing things, even as the disease go away. Those are going to be big challenges for us over time. But I think the public has responded in a really amazing way. Of course, it's not perfect. We've got most of our community to stay home, and we can see that reflected in the data. We've seen that flattening of the curve. The goal of that was to stop disease transmission, make hospitals able to handle all these cases that come in, and we've done an incredible job of doing that nationwide so far.
Dr. Kushar, I want to reference something that Brian said on a previous show, and this is a show that both Dr. Saad and Brian were both on. We were talking about pandemics and epidemics in general, and at that time, COVID was not anywhere near of a risk. We talked about it briefly, but we did talk, Brian, about how a pandemic is local. We have our own local unique needs. We have our own unique solutions and ways to treat that. Dr. Kushar, you're the data person here. You're looking at, I can't imagine the amount of data points you are looking at and analyzing on a daily basis. What do you find particularly unique about COVID-19?
I think one of the most unique things about this disease is that other viral diseases like influenza, you usually see that the most impacted groups in terms of mortality are usually at the either end of the age spectrum. So kids and older adults. In this, kids thankfully are almost completely spared. There are reports of of occasional deaths, which is very tragic. But most of the deaths are coming in the age group greater than 65 years of age. So that's one thing that I find really unique about this. I think there are also new reports that are coming out that to me are kind of concerning. There have been case reports of other outcomes associated with this, such as potential clotting disorders. So people developing ischemia of a limb or developing a stroke or things like that. And that's sort of new reports that are coming out, and that's kind of concerning. And that's also very unusual for a respiratory viral illness.
And what does that mean? I mean, obviously that's an immediate concern. It's something that, I mean, does that maybe indicate that the virus is evolving itself, or just that we, particularly here, especially in the United States, are seeing maybe these types of results?
I don't think it has to do with the virus evolving. I think it just really underscores the fact that this is a new disease and there's still so much we don't know about it.
Yeah. Well, let's talk more specifically then, Dr. Koshar, about the data. Of course, we're all looking at the most straightforward indicators here, how many cases we have and death rates primarily. There's obviously nuances in that data, especially when we're looking at potentially reopening and kind of where we are right now. What's some of the nuances that you're looking at when we're looking at just kind of more of our standard data here?
Well, I think one of the nuances is that, how the shape of the curve and when the peak is sort of depends on what type of dates you're using. So I think one of the most important ones is the symptom onset date, because that gives a good proxy for when someone was infected. It's not perfect, but it's a better proxy. And for that, from SNHD's data, we're seeing that our highest number of cases probably happened in the first week of April, and the same with deaths. And it's been trending down a little bit since then. We're talking about a pretty short time frame here, so I think we all want to get excited, but next week things could go up as well, and especially if we start to back off on the social distancing. Sometimes I think one misunderstanding that people sometimes have is that, so Southern Nevada Health District reports this data daily, and we try and be as timely as possible. But report dates, so basically when we are notified about this disease, is not instantaneous. So someone may have gotten infected, waited a week to go to the hospital, and before getting a test and before that's reported to us. So if you're going off report dates, we could be talking about something that we're seeing 1 or 2 weeks ago. And really this sort of changes the shape of the curve and what we're talking about. So sometimes people will see, an increase in the number of cases or number of deaths in a certain day, but that could also have to do just with the time frame of when it's reported to us.
Dr. Kokorn, let's get away from looking at just the more standard data. Let's look at kind of hospital capacity. What are some of the data points that you're looking at just to make sure that hospitals can keep up with what the demand is right now?
Yeah, so, when we started seeing an influx of patients into Clark County, there was an appropriate level of alarm and concern about making sure that we could handle the capacity. And interestingly, we've actually seen a decrease in the amount of the patients who would routinely come into the emergency room, come in for elective surgery and what have you. So, at most of our 8 facilities in Nevada and California, and certainly throughout the valley here, we've not seen capacity concerns like we had planned for. And that's a good thing, right? So the good news is that our hospitals, we're prepared for a surge. I want to call out the Southern Nevada Health District. They've done a phenomenal job of coordination and leadership and promoting cooperation among all the facilities. And, in line with their asks, we have surge plans that, looked at increasing our ICU capacity by a third. We kind of went beyond that and looked at an even bigger surge plan for our own hospitals. But, as one of our neighbors, Mike Tyson, famously said, everyone's got a plan until they get punched in the face. And, just like the surge plan that was in place the night of 1 October at sunrise, they had a surge plan, but never anticipated 300 patients coming in 2 hours. So, we feel very confident at Sunrise Mountain View and Southern Hills that we are poised to deliver the care that the patients in the community need.
Yeah. Well, let's move ahead then. Let's talk a little bit about the at least the not the well, it is the immediate future. The state recently released a reopening plan. I just want to go through in summary some of the key strategies to begin phase one of what reopening would be. 14-day downward trend of cases and hospitalizations. Healthcare systems are no longer in crisis mode. They have enough tests, and there's enough of a workforce, at least a couple of those, Dr. Assad, we've already talked about. And number three, vulnerable populations show that there's virus containment going on. We've talked about mostly focused on long-term care facilities, senior care facilities, things like that there. Dr. Assad, I want to start with you. We all want to know the answer to this question. How close are we to getting to that 14-day window?
So the 14-day window of either a plateau or a downward trajectory in the number of new cases that are identified. So at least for the last 7 or 10 days, I can tell you that we're sitting at about 12% of new cases that are identified, which is somewhat reassuring. I don't think that that's enough of a time period as yet. And I think we still need to be very careful about this number. Let me put it this way, I'm cautiously optimistic at this stage. But yes, at this point, for the last few days, we're sitting at a plateau as far as the new number of cases as a percentage of the total number of cases tested daily is concerned, yes.
And Dr. Kishar, you've already mentioned we've seen a little bit of a plateau. Things look good, but we could see another rise. Are there any other indicators that you're looking at that show that we could get to this sooner rather than later?
There are a lot of different models out there, and they're all based on a lot of different assumptions. And a lot of these models have estimates that vary wildly. So, for me, I don't want to project too much into the future. I think with another week or 2 weeks of data, I think we can be very sure of the trajectory we're heading to. I know that this is difficult because people are being put out and they need to get back to work, and people are running out of savings, and so this is just a real challenge. But one of the things that really worries me is that right now I think people are sort of getting fatigued of staying at home, and COVID no longer seems new and scary, and so people are starting to relax their guard a little bit. And so that worries me, because if we start to see a resurgence in cases, I think we may be caught unprepared.
Now, Dr. Kishar, we're not only hearing just about testing, we're hearing about antibody testing as being extremely critical here. Is that something also that is in dire need here as we move past phase one and look at more of a reopening plan over the next several weeks, or several months, I should say?
Yeah, I think the concept of antibody testing is really important. I think there are still some kinks that need to be worked out. There are a variety of tests on the market, and we still don't have a great understanding of if someone has evidence of a prior infection, what does that mean as far as their long-term immunity? We suspect that they have short-term immunity based on our understanding of other coronaviruses, but we still don't know how long that immunity lasts. So I do think this is really important to gauge the prevalence of infection or previous infection in our community. But I think there's still a lot of additional questions that we need to answer. And I think a lot of these questions are going to be answered in the near future with a lot of new studies.
Dr. Corcoran, we lost you for a second, but we were talking about the capacity here and potentially how many tests we might need to do on a daily basis. And I want to talk just a little bit about capacity to perform those tests, the workforce that we need for something like that. And then, of course, just having the tests and the lab capacity itself. Do you think we're prepared potentially to have 180,000 per day tests performed here in the state?
It kind of depends on your perspective of the supply chain. So while we have new capacity coming out from providers all the time, lots of innovative technologies being developed, sometimes it's the weakest link of the chain is the simplest stuff. It's getting swabs. It's getting universal transport medium. The stuff that you've kind of the bread and butter of viral testing is in the shortest supply. So, we've actually shared a recipe from the CDC about how to make our own viral transport medium. So, yes, I think we have the capacity grand scheme, but I worry about the little pieces, right? And then as far as that goes to helping us kind of relaunch our life as we know it, I think that we appropriately used a blunt instrument and hit the brakes hard when we closed the casinos and we really shut down life for much of Nevada. And I think that as we take a more surgical approach to the opportunities to open back up, we can do so successfully. And one of the things that I think is really being overlooked in our recovery as the state of Nevada looks at it is we have access to the great outdoors. Right? How much of our state is about being outdoors? There's a great study that came out this morning, 318 outbreaks I had studied in China. Only one was tied to outdoor exposure, and that involved 2 cases, right? So, why don't we think about surgically reopening our outdoors and getting people out of their houses and not necessarily congregating as neighbors, but getting them outdoors and enjoying this state? What about the hiking trails? Maybe close the visitor center, but reopen Red Rocks trails, right? What about golf courses? What about boat ramps? Get families together outside being healthy. Because don't forget, we're not just fighting coronavirus, we've got all the other diseases that we're dealing with, right? So I think that as we reopen, we just have to think very strategically and surgically about how we open up these opportunities, especially taking advantage of the great outdoors.
Dr. Kokorin, great point. Brian, I want to come to you on this too, because we're talking about a lot more, obviously, than just containment of the disease. As we've mentioned already, we as a public are very itchy to move on to the reopening. That opens a door also of what else do we need? We've talked about testing. We've talked about maybe other strategies involved in getting people out. Is there anything else that's critical right now that we need to be looking at that's top of mind, key strategies to get us to where we can start looking at reopening phases?
We have to start thinking about what social distancing mechanisms we can maintain as we start to reopen things. So there are things that we've been doing like with restaurants, where we only have carryout rather than dining in the restaurants. So those sort of approaches can work to allow businesses to open and also mitigate the risk that comes with opening those businesses. So in business, I think that'll reduce that risk is something we're obviously going to consider. We also seriously have to think about people wearing masks in their day-to-day situations. If you go out in public, people are wearing them. And so that's something we can do to reduce transmission. I could see that being something of some important part of our guidance, because that will allow us to mitigate the spread of disease and open more businesses with fewer restrictions, but still protect people. So we have to really be as creative as we can in thinking about how do we stop that transmission as we start to open these places.
Yeah, creativity. I think that's a great way to end our show. Unfortunately, we are out of time. We thank you so much for your time and expertise on our show today. Thank you so much. Thank you for joining us for this episode of Nevada Week. For any of the resources mentioned on today's show, please visit our website at vegaspbs.org/Nevada-week. You can also find us on social media at Nevada Week. Stay healthy and stay strong.
My fellow Nevadans, please follow Governor Sisolak's direction.
As Nevadans, we must all work together to care for one another and to act with compassion.
By staying home, we can protect our loved ones and our neighbors.
And never forget that as Nevadans, we're all in this together.
Thank you, governors, for your lifetime love and support for the Silver State. If home means Nevada to you, stay home for Nevada. Visit www.nvhealthresponse.nv.gov for more information.
National conversations have begun about when to reopen the country following COVID-19. Jim Murin, chair of Nevada's COVID-19 Response, Relief, and Recovery Task Force, says more data is needed before our state returns to a new normal.
One of the key messages I need to make very clear that epidemics are very, very local. And so yes, we've seen some very encouraging signs in other parts of the United States. That does not necessarily extrapolate to the rest of the United States. And so what's really critical is to get as much localized data as possible. The only way we're going to have proper data is testing. It's critical that all of us in Nevada understand that we have to take these precautions very seriously and do not relax any of the protocols that the state and the federal government and the CDC have been very clear about.